Hello and welcome to my video answering all the questions you guys have been sending me. I've decided to split them up into 3 different videos combating different sections. So the first video is going to be centered around questions related to working as a physician associate. And the first question is, what is a career progression like specifically within general practice? So this is a little bit difficult for me to answer. One, because PAs have only really been around for just over 10 years. So there's not really a specific career progression ladder at the moment that I can say, this is what it's like, this is what you can expect. It's a lot of paving your own path. However, hopefully with regulation, we'll be able to do more and have more responsibilities, and therefore there might be some sort of a progression ladder in the future. Fingers crossed. However, from my personal experience, again, it's quite difficult because I only really qualified last year, and I haven't been based in one job the entirety of the time I've been qualified. Where I graduated, prior to qualifying, I was working as a healthcare assistant within the general practice that I was having placement in as a student, and then I worked as a locum for 5 months. Whereby it was a lot of spoon feeding locuming, I will be honest with you guys. Even though it was a locum position, it was somewhere that I was very well supported. They were very aware that I was newly qualified and they were happy to have me on board. So during that time, it was a lot of kind of really solidifying my knowledge that I had gained as a student and gaining extra experience. It wasn't really much of gaining extra skills. So for those 5 months of locuming, that's what it was really about. Then I took a month off just to relax and rejuvenate before accepting a permanent full-time position, which I'm currently in. So I'm hopeful, fingers crossed, that in this position is where I will flourish and I will really progress a lot in my career. Progression to me is gaining an extra skill set. So whether that's, going to courses such as child immunizations, cervical smear tests, minor surgeries, doing things such as coil fitting for contraception. There's just such a variety of things you can do, even taking on courses to really understand spirometry and peak flows, and honestly, there are so many more things you can be doing in order to progress academically. Obviously, there's the progression of salary. There's also things such as progressing to become a more integral part of the team. So if you're working somewhere where there are other PAs being recruited after you, or maybe you're a senior PA and you're recruited somewhere where there are maybe less senior PAs, newly qualified, kind of like me, you might have the opportunity to be a lead PA, and I don't really know what that entails. Maybe it entails taking part in teaching, and I don't really know, I'll be honest. I don't know any lead PAs at all, but I've heard of the word being thrown about here and there. You could also do things, like I said, teaching. You don't necessarily have to be lead PA to do that. You can also sometimes, specifically for general practice, if you're working somewhere where you've shown your dedication, your motivation and your commitment to the practice, you might be given the opportunity to become a practice partner. Now, this is something that's far and few between. I've only ever heard of 2 PAs who have been given the opportunity of taking that position. It may involve you being more managerial and taking more responsibility for the practice as a whole. Again, I don't entirely know what that involves, but it counts as progression. So it's about paving your own path. What do you want to do? Do you enjoy dermatology? And do you want to really zoom in on that and base a lot of your clinics around that? That's your special interest. Or are you working in secondary care where you're working in a speciality and you'd like to gain those skills to be able to add value to your team? So progression is very subjective. So the next question goes off really smoothly, which is, what's the salary progression like? So again, this is really difficult because it depends on so many different factors and variables. I always say it depends on where you live, so where you're working, the area, the city, the country even. So for example, to put it into perspective, if you work in America, you earn over $100,000 a year, whereas in England, the Agenda for Change guidelines is around 38 to 39,000 a year. However, to put it into perspective, when I first applied to jobs last year, I had an offer for £37,500 a year, and now I am actually currently on £46,000 a year. So it is something very varied, very different. I would recommend it. Genuinely does depend on the job and what suits you. So for example, if you are, really keen to work in a GP and you've got a GP practice close to home but not close enough to bump into the patients, where they provide you with a parking space if that's important for you, whether they reimburse you for the CPD events you pay for, they really encourage teaching, they're really helpful and supportive, and you're just in general really happy there and you can see yourself flourishing there, then I would say a couple £1,000s a year difference working somewhere where you might not be as happy or as supported is actually more important. Obviously, it does depend on if you're working in secondary care or primary care, so that's whether you work in GP or whether you work in hospital, as the trusts or the primary care networks have different budgets for recruiting PAs. Obviously, it depends on your experience. So if you're newly qualified, I wouldn't be too burdened by the salary you're offered. Try to negotiate, don't get me wrong, don't just accept something because it's the going rate that you've been given. Always try to negotiate during your interviews. You can always push a little bit extra just to squeeze the employers a little bit. But yeah, I think making sure you're being appraised every year, and maybe your salary might reflect that as well. Gaining more skills would reflect your salary and your income. So it's so varied. I know PAs who are a lot more experienced than I am, who are earning less than I am. I also know some PAs who are newly qualified and I am more experienced in comparison to them. However, they're earning more than I am. So it really does depend on so many different factors. I wouldn't get too bogged down about it. I would be vigilant though. Compare and contrast with what the friends are earning around you. So don't compare someone. So for example, I live in London. I'm not going to compare what I earn compared to someone who's living in Wales or Scotland, because it's just a bit silly. And of course, if you do live in London and you're working in London, you may get the London weighting, which is an extra £5,000 on top of your salary. What I will say though is that I have worked in London in the past, and I wasn't offered the extra £5,000 London weighting. So just because you live and work in London doesn't mean you're guaranteed the London weighting. So I think if obviously you want to earn a lot, then locuming is probably the best thing to do. I was on £32 an hour. It's not the highest locum rate. I was newly qualified, so if I was to locum again, maybe I'd try to negotiate a little bit higher. But £32 an hour, I mean, I wasn't complaining, but you can earn as much as 45, I've heard from one person. So it varies. Okay, so the next question goes off really smoothly again from what I've just said, which is how did you end up locuming? So I actually really accidentally out of the blue ended up locuming. So what happened was I actually applied to a position, and during my interview they said, at the moment we just don't have the funding to recruit any PAs, but we're happy to have you as a locum post until we get the funding sorted. Is that okay? So I was like, yeah, that's absolutely fine. I was still getting the supervision. I was still getting all the, teaching perks of a permanent PA role. It wasn't expected of me to be, locuming and being independent and autonomous and really knowing how to get the job done. I was still getting trained on how to use EMIS, which is one of the softwares we use in GP, because previously I had only used System 1. So my point being, even though my role was a locum PA, I was actually still taken under someone's wing and trained and, treated like a like a baby. So I would say that if you do want to locum initially at the start of your career, try and let them know that actually the reason why you're locuming is because you want to find a practice that really suits you before you commit to it permanently, and you just want to experience and engage working in different environments with different people. However, you are still newly qualified, and even though you're enthusiastic and keen to learn, you do still need quite a lot of supervision. That's the angle I would recommend if you are a newly qualified PA, just because I wouldn't recommend locuming if you've not done it before and if you don't have much experience, because it is very independent, and definitely get an indemnity sorted as well. So I started locuming because I applied for a permanent post, and obviously it didn't end up being that. And then the place I was locuming, my boss's sister was looking for a locum at her practice. So then I started kind of networking and bouncing off different GP practices. So the next question again goes really smoothly, and it's how much support should be given to a new PA working in GP. So without a doubt, regardless of whether you're a new PA or you're not, or you're hugely experienced, you should always have an induction period where you're getting to know your colleagues. You have a little bit of shadowing time, sitting in with the different clinicians. I actually was told in one of my inductions to sit with the receptionists to see what kind of conditions come in, what kind of patients we have. So again, it's just settling in. Make sure that you're up to date with all of your certificates, so safeguarding, adult learning, adult safeguarding, and all of the BLS, ALS, all of that good stuff. So support wise, during your induction, I ended up in the third or second day of my induction actually having my own clinics, where I actually debriefed pretty much all the patients with my supervisor that was given to me, and that was really helpful because you gauge on how the practice runs. So some practices are a little bit more lenient on sick notes. Some practices are very strict and they charge. So the induction period is really important so that you kind of mesh well with the practice you're working for. In terms of ongoing support, I think it's so important to work somewhere where they're aware of your competency and aware of how much you can do, and giving you the autonomy where you need it, but also having that open door policy where if you're stuck and you need some guidance, they're more than happy to sit down, talk to you and teach you. As a physician associate, I think our knowledge is not in abundance compared to GPs or anywhere else that you're working. However, it's so important to work somewhere where they're open and they're willing to take you to that next level and give you that knowledge, so next time you come across the same thing, you know exactly what to do. So I personally wouldn't recommend working somewhere that clearly isn't giving you the support that you need at that stage of your career. So the next question is, how often do you come across stigma as a PA? Now, this is a question I get asked all the time in different ways. So I get asked, do people look down on you for being a PA? Do doctors question you for not being a doctor? And the answer is, personally, from my experience, I've never come across anyone being negative about my profession. And I've never had a patient ask or demand to speak to a doctor. Actually, what tends to happen is they'll ask me, am I a doctor? And I'll say, no, I'm a clinician, I'm a physician associate. And then they just don't really care after that. Once you start asking them and taking a history from them and actually helping them and building a rapport and gaining their trust, at the end of it, they actually end up saying, oh, can I speak to you next time? Or can you call me back for my next appointment? And so on and so forth. So personally, I have not. Okay, so the next question is about indemnity. Now, I didn't have my own personal indemnity because I was always covered within the GP. However, as of late, my current employer really wanted me to have my own indemnity. So during my interview, I said, and I made it quite clear that I will pay for it as long as I get reimbursed. And so that's what happened. I pay £550 for the whole year. And essentially it's just to cover me, just in case I get taken to court. If a case is taken up against me, then my indemnity will cover my legal fees. So indemnity under your GP is, you have indemnity to an extent. However, if legal action is taken against you, if you have your own personal indemnity, the legal fees will be paid for under that. So the next question is, did you start working straight after nationals? No, I started working before I qualified and passed my nationals. A lot of my friends applied to jobs and had a job lined up for when they passed their nationals. A lot of my friends did their inductions before they qualified, so that once they qualified, they went straight into the job. I actually started working as a healthcare assistant somewhere that I was a student in. So before I qualified, I just kind of carried on working there for a little bit. And yeah, it's really subjective. I have friends who didn't work for about 3 months even after they qualified just because they wanted a break. But yeah, I don't think it really matters. I think PAs are such an integral part of the multidisciplinary team, and so many places are looking to employ PAs. So as long as you don't have a huge inexcusable gap in your CV, I don't think it really matters if you start working straight after nationals, before, or a little bit after. Okay, so that's the end of my video answering all the work-related PA questions. I do have a ton of questions centered around being a student physician associate and also being a pre-physician associate applicant. So I will be doing another 2 videos answering those questions. However, if you have any further questions related to working life as a physician associate, please comment them below and I will try to accommodate another video at a later date answering them. Thank you for watching. Please do like, share and comment.